The MetaNeb system configuration includes a controller, stand, and disposable circuit kit. The circuit kit comes with 2 adapters and a black occlusion ring. The controller's components include a pressure manometer, mode selector switch, higher-lower switch for the CHFO mode, CPEP flow adjuster, circuit tri-connector port, master on-off switch, oxygen gas connector, and the mount bracket. The stand components include a pole and base. The assembly instructions are included with the stand. To move the stand, unlock the 2 locking caster wheels, move the stand to the applicable location, and lock the 2 caster wheels. The MetaNeb controller bracket is attached to the stand, and the height can be adjusted to comfort. To assemble, loosen the knob on the bracket arm. Put the controller on the pole. Adjust the controller to the applicable height on the pole, and then tighten the knob on the bracket arm. Attach and hand tighten the oxygen hose to the connector on the controller. Install the applicable hose adapter on the free end of the hose as necessary for your facility. The MetaNeb system's disposable circuit components include a mouthpiece, selector ring to adjust resistance, handset, biofilter, tubing, nebulizer, orifice indicators. The other accessories include a 22mm by 15mm adapter, a 22mm by 22mm adapter, silicone adapter, and a black occlusion ring. When using the MetaNeb system in line with a ventilator, use the black occlusion ring included with the circuit in place of the blue selector ring. The black ring will completely occlude the exhalation orifice opening to provide a closed system. When preparing to attach the circuit to the controller, note the orientation of the tri-connector port. In order for the circuit to fully seat, the tri-connector port needs to be in the correct orientation. It is important that the circuit is fully seated in the tri-connector port. You may feel some resistance when the circuit meets the rubber gaskets. Continue to push until the circuit is in full contact with the faceplate. Do not force the circuit onto the controller. Turn the connector 45 degrees counterclockwise to lock the circuit into position. Remove the nebulizer from the package. Assemble the nebulizer cup before you attach it to the circuit. Make sure the green cone within the nebulizer stays intact. Connect the nebulizer to the nebulizer port on the bottom of the handset. Connect, but do not twist the nebulizer hose of the tubing to the bottom of the nebulizer. Make sure to push the bushing all the way onto the nebulizer stem. For complete instructions, see the MetaNeb System User Manual. The MetaNeb system allows for 4 different patient interface options to the handset on the disposable circuit: a mouthpiece, a facial mask, a flex tube adapter to a tracheostomy, or a connection to an inline ventilator by connecting to the inspiratory limb of the ventilator circuit. Attach the mouthpiece to the handset by inserting the mouthpiece at a 45-degree angle and gently push it in and twist to the correct orientation. Another configuration is using a mask instead of the mouthpiece. To connect the mask, use the appropriate adapter provided with the circuit. Connect the mask to the circuit via the adapter. If the patient has a tracheostomy, a flex tube adapter should be used to connect the circuit to the patient's tracheostomy. The flex tube adapter is not included with the circuit. For patients on a ventilator, a spring valve T adapter should be used to connect the circuit. This adapter is not included in the MetaNeb disposable circuit kit. When using with the mouthpiece, face mask, or tracheostomy, there are 3 levels of positive expiratory pressure resistance available on the handset. The 1-dot position is the largest opening with the least resistance. The 2-dot position is the mid-sized opening between the least and most resistance. The 3-dot position is the smallest opening with the most resistance. For complete instructions, see the MetaNeb System User Manual.